Department of Emergency Management, Mary Ellen Carroll, the Department of Public Health, Behavioral Health Director, Dr. Hillary Kunis, and we are also joined by our Police Chief, Bill Scott. I am here with our various leaders in San Francisco to officially declare a state of emergency in the Tenderloin community of the City and County of San Francisco. We know that there have been a number of challenges that have happened in this community and have persisted over the years. But if we take a step back, when this pandemic first hit San Francisco, of course, we immediately, in light of what we knew was inevitable, declared a state of emergency to deal with the global pandemic of COVID-19. And in fact, what we saw over the last almost 2 years was San Francisco step up, remove the bureaucratic layers and the obstacles that get in the way of actually being effective, and collaborating with our various city agencies. And what we were able to do to deal with the pandemic was extraordinary. We are one of the densest cities in the country, and with less than 700 people who lost their life throughout the entire pandemic, we saw one of the lowest death rates of any other major city in the U.S. and San Francisco, not just because we acted quickly and shut down early, it's because we had the ability to move quickly and set up our various locations, including a COVID command center, embedded equity into our response to help deal with challenges all over the city. But the sad reality is, when we look at the loss of life in the pandemic, which every lost life is tragic, we had over 700 people alone die due to a drug overdose last year in San Francisco. We have over 600 and counting this year. When we look at the conditions on our streets, it is really unfortunate, it's sad, it's heartbreaking, and I must say, what doesn't get publicized enough is the fact that not only do we say, and we are a compassionate city, the amount of money that we spend on services to help people struggling with mental illness, substance use disorder, all of these various programs, our street crisis intervention program, our street overdose team, our wellness team, additional resources for Narcan, the organizations that we work with that help put people on the streets to assist us with those struggling from addiction and mental illness. The significant increase in the number of behavioral health beds in our system, a robust outbuild of mental health SF. We've done a lot of work to try and turn things around because we know that suffering from those things are not easy. It is not just about homelessness. It's about addiction. It's about the fact that there is clearly in the Tenderloin community, with the conditions of not just the streets, but the people living there and the people suffering, that we are in a crisis and we need to respond accordingly. It's not just about our police response to make sure that when people cross that line and commit crimes, we hold them accountable. It's not just about that. It's about getting people the help that they need and being able to do so quickly. I've said this time and time again. If you don't know what it's like to experience an addiction, and I hope to God you never find out, we have to meet people where they are. We can't wait for something to be set up. We have to move quickly. We can't wait until something goes through a layered process. We have to move quickly. Too many people are dying in this city. Too many people are sprawled out all over our streets. And now we have a plan to address it. A robust, aggressive plan to address it. Earlier this week, I made it clear that there are going to be a number of things that this city is going to do to address public safety. And part of that is a police response. Part of that is accountability. Part of that is making sure that we are consistent. But the other part is being aggressive about getting people into services and support and not allowing what has happened on our streets to continue. Not only the fact that people who are suffering from these things are randomly committing acts of violence towards people who are just walking down the street, not to mention the number of shootings and stabbings and other things that are happening randomly in this community, but also the high number of people who are dying from fentanyl overdoses. So leading this effort to address this emergency will be Mary Ellen Carroll, and the work that we have in place after our assessment will allow us the ability through this emergency declaration to move quickly, to move fast, to change the conditions specifically of the Tenderloin community. This is necessary in order to see a difference, in order to reverse some of the deaths from overdoses and the assaults and attacks and other things happening in this community. So at this time, I want to introduce Supervisor Matt Haney, who represents this district, who supports this declaration of emergency, who I know has been consistently advocating for additional resources. And let's be clear, this city spends more money on social services in the Tenderloin community than any other community in San Francisco. So just pouring money into this or doing the same thing, as I said earlier this week, is not going to give us a change. What's going to give us change is being aggressive about what we need to do to change these conditions. The most important job that I have as mayor is that when people walk down the streets of San Francisco, they should feel safe. They shouldn't have to look over their shoulders. They shouldn't be punched in the face randomly. They shouldn't have to see someone sticking a needle in various parts of their bodies, laying out on the streets and wondering, what can I do to help them? They shouldn't be spit on. We have to have an honest conversation about people who suffer from mental illness and substance use disorder and someone's right to do so, especially when it crosses the line and impacts other people's ability to feel safe in our city. And that's what this emergency declaration is about, addressing those challenges, understanding what people are suffering through, and meeting them where they are. And so at this time, I'd like to ask Supervisor Matt Haney of District 6 to say a few words.
I want to thank the mayor for her focus, for her urgency, and for her courage in today's announcement. The Tenderloin is a community of residents who want and deserve safety, who want and deserve health, and who want to survive. They need help, and this is a statement of the urgency that help is on the way. Our city came together over the last few years and threw everything we had to confront a deadly epidemic. And because of those actions of the people who are standing up here, we save lives. And we have to do that again. The overdose epidemic is taking the lives of nearly 2 people a day in our city. Most of those people are in the Tenderloin or the south of Market, and mostly from fentanyl. And if we are going to stop this epidemic, if we are going to save lives, we have to once again throw everything we have at it. We need resources, we need coordination, we need tracking, and we need it now. We cannot wait to take action. Every day that we wait, anything that is getting in our way to move slower may cost lives. And this is something that we know we can do. We did it over the last year and a half, and we've done it in the past. Decades ago, there was another epidemic that we faced, which was HIV and AIDS. And this city came together, we led the way, and we saved lives. And so even though this is an epidemic that not only is impacting our city and is not only impacting the Tenderloin, it's a national epidemic, San Francisco once again has to lead. We have to demonstrate through commitment and compassion, not looking the other way, but confronting the problem, that we can stop it, we can turn the tide, and we can save lives. And I think if there's anything we've demonstrated over the last year and a half under Mayor Breed's leadership, under Director Carroll, Director Kunis's leadership, that we can absolutely do this. But it takes us treating it like the crisis and emergency that it is, and that's what we are doing today. So again, thank you, Mayor Breed, as the supervisor of the Tenderloin, but also as a resident of the Tenderloin. We need an emergency crisis level response to confront this deadly epidemic at the scale of the problem that we're facing. And you have my full support and partnership to get that done. And I want to thank you, Director Carroll, and also Chief Scott and Director Kunis for your partnership on it. And with that, I want to introduce the person who is going to lead this effort, who was a huge part of leading our effort through the COVID-19 pandemic, bringing together resources, bringing together staff, unprecedented focus and speed to confront a pandemic. We have to do it again with this deadly epidemic of drug overdose. So I want to welcome up now Director Carroll.
Thank you, Mayor Breed, and thank you, Supervisor Haney. In emergencies, people need resources immediately and not months from now. An emergency declaration allows San Francisco to cut through the red tape, to obtain the contracts, the resources, and the personnel that we need to address the crisis conditions in the Tenderloin. We only have to look at our COVID response to see how an emergency declaration allowed us to quickly lease hotels, hire critical staff, and establish testing and vaccines. And if you remember, when we did that declaration, there was a lot of questions about why we were doing a declaration so early before we even had a case in San Francisco. It is because we knew the lead time that we needed, and we knew how important it was to have the ability to conduct and get those resources quickly. That's what today's action is about. It will allow us to streamline and coordinate essential services and resources. This includes in speeding up the establishment of a linkage center that, once activated, the site will connect individuals in crisis to resources like substance use treatment, counseling, and medical care. To date, we have already conducted neighborhood assessments, community stakeholder engagement, we've coordinated interventions, infrastructure improvements, and helped people in crisis connect to social services. I just want to reiterate that the emergency declaration is really about removing obstacles so that we can go in and conduct the work we need to do to help the residents of the Tenderloin. Our goal is to get those services coordinated as quickly as we can in order to alleviate the overall suffering that people are experiencing in the neighborhood. Thank you very much. I'll turn it back to you.
So with that, are there any questions? So can you go back to the first question? So the challenge we have with our conservatorship process is it requires that we wait until someone is 5150, which is a 72-hour hold, at least 8 times before we can implement a course of action which goes through a lengthy court process. From my perspective, it's not strong enough to be as effective as we would like it to be. And I think that's why we have to use our alternatives of not giving people any option when they are struggling with addiction and have challenges with mental health. We have to take them somewhere. So either that somewhere is going to be San Francisco General, depending on their condition, or that somewhere is going to be a location that we will set up as a result of this emergency declaration. And the goal is to not let anyone stay out in the streets and not give them an option, and to enforce many of our various laws that are on the books, including sit-lie and camping and sleeping and other things. So we're going to be a lot more aggressive with implementing existing laws that are on the books in order to get people off the streets. And unfortunately, the conservatorship that we were hoping that would work more effectively does not work as effectively as it should. And then
why the change in 2 months? Your spokesman told the Chronicle 2 months ago that, if we did declare an emergency for the opioid crisis, that we weren't sure that it would let us be able to do anything that we're not doing now, is the quote that we had. So I'm wondering what's changed in 2 months.
what's changed is we were at that time working with the Department of Public Health, working with the City Attorney's Office to understand how we can get more creative on declaring a state of emergency, because the problem we were having is technically under some of our various laws, it wasn't in terms of what was put forward and what was suggested, it wasn't something that technically we could use legally as a basis. And so we had hunkered down, got creative, worked with our attorneys to figure out a way, because clearly, even at that time, it was a crisis. We were seeing people die. This is not something that just all of a sudden happened. It's just that we were able to find a way which we needed in order to address it. And so that's what we did. My hope is that it will definitely save lives, because we're talking about, you hear about people who are saying, well, someone's laid out on the street, what do? We don't know if they're dead or alive. The ability to allow for our street wellness teams to do checks, but more importantly, that person probably needs to be monitored. And so part of our process is removing them from that location and moving them inside to a location where we have the kinds of folks that could monitor, that could provide resources. But more importantly, we're not here to judge. We're here to say, we're here, we're paying attention, we don't want you to die. And so we're going to do everything we can to support you, but we got to get you off the streets.
San Francisco public defender has said that expanding the police presence in Tenderloin will be harmful to people who are already over-policed, underserved, and that it cuts against the promises you made in the wake of the murder of George Floyd to invest back in the police. What's your response?
It doesn't, because we're still making those investments, and we have. When you look at the city's budget overall, you see significant investments in programs, including a commitment to the African American community for $60 million a year ongoing. And so you tell that to the families who I met with, who are in tears from the attacks, and telling me that they want the police there, telling me that they call the police and they want them to show up. The families and the people who live there, has anyone from the public defender's office or anyone else had a conversation with these mostly immigrant families who could barely speak English, who feel uncomfortable and unsafe walking their kids down the streets? So have the public defender, give them a call and have the conversations and see what they want and what they need to protect their lives and their children. Everyone in theory can talk about all the policies they want around no police and defund the police and all of these other things. But at the end of the day, if someone beat your kid, like that 11-year-old girl, who are you going to call to protect you? And that's the point of this. We have worked very hard in this city to turn things around with the challenges that have existed historically in the police department of San Francisco. And I'm very proud and confident in Bill Scott and his leadership and the various trainings, anti-bias trainings, the new recruits, which have made the department more and more diverse and understanding of various communities, making sure that we're sensitive to the need and we're not creating these barriers to those who in the past have historically had challenges with the police. We have people who want a relationship, businesses in the Tenderloin who want a relationship and treat their police officers with kindness and respect, the same with the police officers towards them. So folks can say what they want about all of this, going back on your word, this and that, but at the end of the day, the people in this community are not safe, and it is not fair, and it's not right. And part of the response to this is definitely police officers. And they're deployed in the Tenderloin, too. But let me just be clear, and the chief can talk about that, this declaration of emergency is more so about making sure that we are dealing with our public health crisis on the streets. And part of it, separately from that, is definitely a significant increase in our police response. So if you want, I can bring Chief Scott up if you have a specific question. Yes.
Thank you. Thank you, Mayor. Everything that was said today only enhances our ability to do our jobs. Enforcement, we have to enforce. We have to arrest drug dealers. We have to arrest people that are assaulting people. A lot of what people complain about are the street conditions, open air injections of whatever is being injected in people's arms and toes, and those things have to be addressed. The other side of that is our officers have said time and time again, let's have a system where we can get the social workers involved, and that's exactly what this does at the front end, so we can go and do the things that the public wants us to do. Arrest people that are hurting people, stop the open-air drug uses, stop some of the craziness that's going on our streets, and that's what most of us came on this job to do. And I think this only enhances our ability to do that because our officers will work in partnership with our health department and the social services so they don't have to do that. We know we need to treat people with dignity and respect, but most of us came on this job not to be social workers. We came on this job to be cops. And this will only enhance that, and the deployment that has already been increased. I want to echo something real quickly before I end my comments that the mayor said. We spent more money in the Tenderloin as far as overtime funding, thanks to the mayor and the support of her budget office, than any other community by far, year to date. All this needs to come together. We will continue to invest in the Tenderloin. Our officers are working a lot of hours, and they don't mind doing that, but they want good outcomes. We don't want the work to go in vain. So when we enforce, we want consequences when the evidence is there. We need the support, so we're not doing social work. We understand we have to treat people well and treat them right and do the job the way we have been expected, but we need the support. And this emergency declaration, in my professional opinion, will give us that support right now. So thank you.
I'm sorry. Yes, Mary Ellen Carroll can answer that.
Thank you. So we made reference to the linkage center, and so this is going to be a location that we will have that people who are experiencing substance use disorder can come. They can link up with the Department of Public Health resources. They can link with community-based organization resources and treatment. We can find out where they are in the housing system if they need housing, and we can also meet them where they are with some basic hygiene, food. We really want people to, this is really intended to be a warm intervention with people, to engage people. I think I can tell you personally, and I think a lot of people feel frustrated with the lack of intervention and the lack of ways to intervene with people who are suffering on the street. And so this is a place that we can pull people in and get them warm, get them dry, get them fed, and have them connected to all of the many services and resources that the city has. Pardon me? Yes, it is voluntary. People can come in on their own. People will also be given choices. So there's a push-pull. Our intention is to be more pull than push, but there will be, and as the chief has talked about, there may be instances where people have a choice. You know, you're doing something illegal, you're doing something that is harmful in